Okay, Be the Wild asks, what is the real verdict on knuckle cracking? I'm Dr. Goodenough. I'm a hand surgeon at the University of Utah. I'm here to answer your hand health questions. There was a study done recently where they actually ultrasounded people's knuckles as they cracked them, and what they saw is little bubbles of air escaping from the joint. It's probably nitrogen that's dissolved in the joint. We don't think there's any short-term or long-term problems with cracking your knuckles, so if it feels good, you can do it. Amhov says, I'm 30, and since I was a teenager, my hands hurt sometimes. It's like in the bones. For this, there's a really wide range of things that could be happening. It could be very, very benign things, just overuse can hurt, simple things like lifting weights, all the way up to rheumatic diseases, autoimmune diseases. That's really something you should probably talk to your doctor about and get referred over to a hand specialist. Rachel Archuleta 125 says, Hi Rachel. Warrior Healer 95 says, why does the back of my right hand hurt when I do push-ups, but not the back of my other? This is probably related to use. There could be a couple of things going on in really, really young people. So like gymnasts who are still growing, they can put a lot of stress on the growth plates, the part of the bone that's still growing, and that could be a problem. And people that are older, you can get little cysts that come out of the wrist joint that are really, really common, particularly in very active people. So people doing a lot of push-ups, people doing a lot of yoga tend to notice this. And then people can have old injuries that start to crop up a little bit later in life on one side or the other. Most people right-handed, odds are you're right-handed and you've used your right hand a lot more than your left hand, so that seems a little bit likely, but we need a lot more information. Be happy to help you figure that out in our clinics. Thank you everyone for sending those questions. I hope you got the answers you were looking for, and stick around for part 2.